Good evening and welcome to the January 28th, 2026 episode of the Doctor and Athlete Podcast, brought to you by the Global Light Group in LifeWave. I'm Dr. Jon Harmon, and I'll be your host for the next 30 to 40 minutes as we explore this phototherapy patch, this global phenomenon in 82 different countries, the winner of the Biohack Stem Cell Innovation Award as part of a duo of our products that got that for 2025. This little patch, phototherapy patch called the X39. I'm going to get in really, really close so you can see the battery or where you plug it in. Oh, wait, there's no battery and there's nothing to plug it in. So people ask, how could this possibly be a phototherapy patch without an external power source? That's one of the things you're going to learn tonight. And that is, this is a patch that's powered by you. So stay tuned. And by the time we're at the end of this episode, I want to be able to check the following three boxes for you. Number one, does this patch work? I hope I give you enough evidence, and it's global evidence and research, that you will see that this patch works. You'll be able to check that box. The next box would be, could this patch work for me? Will this patch work for me? The third box would be, asking yourself, could I also share this with other people? After all, somebody invited you who cared about you very much. Maybe it's because you have a health issue going on. Maybe it's regarding your wealth. Maybe it's regarding your time freedom. There are so many people who are ill and no doctor can figure things out. There are thousands of different unnamed viruses. There are thousands of different disorders depending on the complexity of the overlay from symptoms from different organ systems. And they might have supplement fatigue. You know, you got to take these before breakfast and this with breakfast and then this in between meals and this. It gets overwhelming, and a lot of people have supplement fatigue. This is not a supplement. It's not something you take. It's not something that you drink. It's something that activates the regenerative and reparative processes in your own body. And the last thing I want to say before we get our guest introduced is I'm going to give everyone an update about Barbara. So stick around. Those of you who stick around to the end, you're going to get that update. But first, we have a very special guest, and I've only known him for a couple of weeks, and I got to share the stage with him up in Tacoma, Washington, thanks to Cami Brechto and Tracy Flintoff. This doctor actually saved Tracy from some things, and I'll let him explain this, but that's how they met, and it was quite a while ago. His educational background is UCLA, Stanford University, University of Southern California School of Pharmacy, Hahnemann Medical College, Drexel University, Gynecologic Oncology Fellowship in Walter Reed Army Medical Center, that was in 78 through 80, Director of Gynecologic Oncology Services, Madigan Army Medical Center, Fort Lewis, Washington. Retired in June 1988 from the Army at the rank of colonel. Everybody salute. Clinical Associate Professor, University of Washington, Department of Obstetrics and Gynecology. Private practice in Pierce County, Washington, including Tacoma and Puyallup. Retired from medical practice in December 31st, 2012. Dr. Lee, hope you're unmuted. Go ahead, and I would like for you to tell everyone a little bit of background about Tracy, maybe a couple of minutes, and how that happened. But then I'd like you to focus on what was going on with you that made you open to looking at this technology and then what the result was?
Actually, it's a long, long story. Um,
Well, we have 10 minutes. Go.
okay, okay. Well, Tracy, she was scheduled for a hysterectomy, and she had lots of trouble getting pregnant, had lots of miscarriages, and her doctor wanted to take out her uterus. She had two large, large fibroids, and whatever happened was that the doctor that she had and I talked and said I would assist in her surgery. If I could help her, I would save her uterus. And that's what I did. I took out the fibroid, saved her uterus, and now she has two grown sons. Well, she is now my doctor. She has cured my chronic hypertension. Let me explain. For 30 years, I've been suffering with chronic hypertension just like the rest of my family. My brother had hypertension and he died from a brain aneurysm. It was my whole family has hypertension. I was so bad that when I went to donate blood, they wouldn't take it because my blood pressure was so high. It was I asked, why can't you take my blood? They said, your blood pressure is over 180, over 110. It's too high for us to take your blood pressure. You go into shock or you will go unconscious. So I went home, told my wife, and she was so surprised. She wanted to get $5 million insurance on me, but it didn't work. Anyway, so long story short, the, this hypertension has been treated with a cardiologist, a very good friend, did everything to control my hypertension. The word is control. It's not to cure, but to control. And what you must do is cure the hypertension. And the way to cure the hypertension is to fix the blood vessel. Because what's happening is my blood vessels were getting hard and stiff, atherosclerosis. It was filled up with everything bad that I ate as a kid. I had a terrible diet. My mother, like all of us, had margarine cooked with bacon fat. I had cereal with lots of sugar in it and milk. And obviously, the whole family suffered from hypertension because of poor diet. That's what just one thing. So it ended up that it killed my kidney. Three things can happen. You can either get a stroke, heart attack, or kidney failure. I got best of three. You can't get a brain transplant. Heart transplant is really dangerous. So I had a kidney transplant. Well, kidney transplants only last for about 8 to 10 years. If you do not cure your hypertension, it's going to kill that new kidney that I got. So the way I've been studying stem cell therapy since 1980, when the first stem cell was given to patients with sickle cell anemia. Most of you don't even know about sickle cell anemia because it occurred in 30% of blacks in Africa, and it protected them from malaria. But the problem with sickle cell anemia, it causes you to die by the year 12. But hardly anybody lived past 12 years old because the red blood cells are odd shaped. They're like sickle. So they call it sickle cell anemia. They're all irregular. They plug up your arteries. They plug up everything in your lungs. You get pneumonia, you get an infection, and you die. Oh, that's what happens. So they found the first time that they cured it with stem cells, and I got very interested. This is phenomenal to cure a disease with stem cells. Then I followed up on leukemia. Leukemia patients that have failed chemotherapy, what they do is treat you with chemotherapy and kill every cell in your whole body and give you back your stem cells or stem cells from a relative, a close relative. So that was another thing that helped me. So and then I found out that they were giving stem cell injections to people who were having problems with the tendons or ligaments in the knees and elbows and shoulders and everything. It would heal those tendons up and knees up. Well, I wanted stem cells in my kidney. So when I went to the University of Washington, they said, no, we don't do that kind of stuff. Nobody does. And so I sat around with hypertension, and I went to the longevity medical clinic, uh, and I was a patient of theirs, and I still had hypertension. They took all my 60 tests of blood, and they replaced everything that I was missing, but it was still hypertensive. So along comes Tracy, with Tracy's mom, which I've been friends with for a long, long time, and that's where I. She told me after all this research I was doing online, everywhere, listen to going to conferences, listening to doctors talk and everything. Here was my patient telling me about stem cells. I wait a minute. I said, how do you know about stem cells? And she was telling me about phototherapy. I said, what do you mean phototherapy? From the sun? No, no, she says from your body. I said, from my body. What are you talking about? And the more she talked, I know Tracy. She she's not telling me any lies. She's telling me the truth. Except this is so bizarre to hear stem cell from a patient of mine, not from other doctors. No, this is from a patient of mine. Well, long story short, I said, okay, I got a perfect patient for you. It's my sister Betty. She had lymphoma twice. She had chemotherapy twice. She had radiation. And whenever I called her after all these treatments, she was crappy. She didn't, she was depressed. She was anxious. She had chronic, she had all kinds of problems, mental problems, knee problems, muscle myalgia, tinnitus ringing in her ears. I said, she's a mess. Let me see what you can do for her. And sure enough, Tracy went and gave her a bunch of patches. 2 weeks later, I called my sister Betty up, and she was a different person. She was my old Betty, and she was wonderful. And so I get choked out about it. But anyway, so after that, I said, God, there's really something to this. And in the meantime, I was studying all the studies that were going on. The major study that was important, and all you should know this, the major study that convinced me this is the truth is the fact that when you put a patch on somebody and you measure their blood, their copper peptides go up. You know, and Dr. Harmon knows all about that. He's probably told you all about the studies. And that one was the key study for me. The copper peptides went up. And if you don't know about copper peptides, you need to do a little bit more study. Copper peptides is the most amazing peptide in the body. It will stimulate the formation of stem cells. Stem cells are the most important cells in your body because what it will do, it regenerates every damaged tissue that you have in your body. My tissue, in my blood vessels was the lining of my blood vessels, the endothelium it's called. It was damaged from terrible habits, eating habits, lifestyle, everything was terrible. And the stem cell patches healed up my endothelium so that it can produce a chemical called nitric oxide. Remember that one. Nitric oxide, not nitrous, that's laughing gas. Nitric oxide is a chemical released by the endometrium that causes relaxation of the blood vessel. So when you relax the blood vessel, the heart doesn't have to pump as hard. And so it doesn't have to pump as hard, the blood pressure comes down. Okay? Because what happens if you don't control that blood pressure, you're going to get heart failure. Your heart will just give up. So therefore, it's very important to get to do this. And from that, I've been off of all blood pressure medicine now. I am completely normal in terms of blood pressure. And my kidneys functions were, remember I told you new kidneys only last for 8 to 10 years? Mine's going 11. At the 9 year mark, the protein called creatinine that's filtered by the kidney was going up. When it goes up, that's a bad sign. That means your kidney is not working. So it started not to work. And sure enough, God says to Tracy, told me about the stem cell patches, and I used it. And sure enough, it brought my blood pressure down to normal. That is amazing. There's no cure. from standard medicine. Traditional medicine is only to control your blood vessel by giving you all 5 drugs I had, maximum doses to control my blood pressure. And really didn't work because it killed my kidney eventually. So,
So you
so
were, pardon
yeah,
me,
go ahead.
you were taking 5 different blood pressure
Hypertensive
drugs.
pills.
Is that right?
Yeah,
Wow.
at
Man.
maximum doses.
And so you had the kidney transplant,
That's right.
but they said if you don't control your blood pressure, the kidney's not going to make it. It's going
No,
to be
that's
destroyed
me.
just like your
I
first
just
one.
the etiology of kidney failure it's the blood vessels. The blood, if it's control your blood pressure, they didn't have to tell me. I knew that.
Yeah.
And because
Okay.
my blood pressure was not still wasn't it was controlled, but it was still hypertensive. And so eventually it would give up. You know, plus there are other factors involved with kidney failures. I mean, that's
Sure.
not the only thing, but that's
But
a
that's a
major thing.
driving force that will take it out,
There you
right?
go. What else do you want to know?
Oh, there's so much I could ask you, but man, you're not just a gem, you're a smart gem. And,
I've done a lot of study on stem cells. I know stem cells, because it's so powerful. If and the problem is, you go to a foreign country to get stem cell. If you go to Seattle to get stem cell injection into your shoulders or knees or whatever they're doing, it's $6,000 an injection. If you
yeah.
go to Panama, Mexico, it's about $20,000 because what they're using is cord blood. The cord blood is from the placenta of the babies, and they filter it and they clean it up, but they got to match your blood type to the baby so that you don't get this host graft reaction, and it will eventually make you very, very sick. And it's expensive. You have to make the trip down. You get a hotel room. You got to stay there for a couple of weeks, and then you get repeated injections. It's not just one injection. You get injections like every month.
And Doc, you said you have had, somebody was asking, you've had your kidney for 11 years, is that right? The
Yep,
transplant?
yep.
And were you taking anti-rejection drugs?
Oh, sure.
Okay.
Yeah,
So
I'm on. Yeah, tacrolimus and prednisone.
it's interesting. And this is,
Oh, but since you brought that up, it is not recommended that people with transplant get patches. But to me, it doesn't make sense because if I had a good immune system and I had a kidney transplant, what's the difference? And if they
yeah.
don't monitor my immune system, it's a standard dose, no matter what. They measure how much tacrolimus is in my blood, but they don't measure T cells or B cells or anything.
And the reason I'm asking is because we've always heard that people who have transplants shouldn't use the X39 because it activates the immune system,
That's right.
where they're trying to inhibit the immune system, and then bad things might happen. But
I'm trying to prove they're wrong.
and it looks like
I'm
you
the guinea
have.
pig. If
Yeah.
my case report goes well, obviously if I die, then I don't you have to figure out why I died. But anyway, to date, my my immune system is good. It's not rejecting my kidney at all.
And
They check it all the time.
how long have you been using the X39?
Uh, this March will be 2 years.
Oh, there you go. So you are a study of one,
That's right.
but it worked. And so maybe
Well,
others will choose to do the same.
if I can prove that it works in me, can you imagine what it will do for the country, for the world? If,
Unbelievable. Yeah.
if stem cells work to heal the kidney, which I'm trying to do, it's if I can heal my own kidneys because my kidneys are almost dead. If they come back to life, the problem is I'm 84. The
Wow.
problem is I've dug myself a big hole and I have to climb myself out of it. And the older you are, the harder it is to get these stem cells working.
And that's why it's important to think long term when we're using this patch. Doc, this has been absolutely amazing. We've gotten a lot of information, and this knowledge of you having had a kidney transplant and your body is responding well to using the patch is just, it's just incredible. And I just want to thank you for coming on. I'd love to see you at another event up there or a LifeWave convention or wherever it is. But
I can't wait until David Schmidt give me a call and said, "Hey, what are you
yes,
doing to our
exactly.
company?" I'm
Well,
not gonna sue them.
I,
It's risk and benefits. Okay, I understand that I'm taking the risk. I am the person.
yeah,
Like I say, I can't sue myself, and I'm not going to sue the company because I know the risk and benefits, and I took that risk.
yeah,
Yeah, and it's
yeah.
possible, but if I don't take that chance, it's going to kill my kidney anyway.
Right, right. Wow.
So what do I have got to lose?
Exactly.
That doesn't make so. There you go.
Thanks again, Dr. Lee. I appreciate you. Now we get to go into the next part of the presentation. How does this patch work? What is it? And again, does it work and could it work for you? Well, I want to tell you how easy it is to share with other, or could I share this product with other people? This website up here, Why the Light, is a very simple website to send people. So if you can copy and paste, they can get to this website and it has all of this great information. I love this down here. We discovered a way to use light, not chemicals, to signal your body's own cellular protection. It's like flipping your body's own repair switch safely, effortlessly, and from within. Why all the research? We have over 80 studies that have been done about this technology. And we start to see from the literature, from the research, that people get tremendous benefit from skin and hair. Dermatologists were the first ones to embrace this, the use of this peptide in their lotions and creams and shampoos and things because of the benefits for skin and hair. I met an esthetician, nurse practitioner 2 weeks ago, and she's using some of those products, but now she gets to add the X39. It isn't a pill, it's not a cream, it's not a trend. But I want you to notice the circle there with the arrows. The inner circle is a crystal structure that doesn't exist in nature. And you'll find out what that is or how that works. And I want you to think of this to help you understand. When you go into, or when you go out in the sun, somehow magically that your body gets the signal to make more vitamin D. Everybody knows that. I'm going to go get some vitamin D. We also get other things out in the sun as well. Men, particularly up on their shoulders, they have androgen receptors and we get testosterone. That's another topic. But this patch is placed on the body and then it reflects back. When I said there's no battery and there's no plug, we make energy and we emit it. There are different frequencies. When you look through night vision goggles, you're seeing a footprint of those frequencies. Part of that gets reflected back into your body, and then it's like changing the channel on the same system that signals your body to make more vitamin D, except we get GHK copper peptide. That's how it works. Okay, I have a very short video for you to watch, and then we'll go on from there.
Light, the energy of life itself. Since the beginning of time, light has sustained us, fueled our growth, and shaped the world. Even Einstein recognized that everything we are is made of light. But what if we could harness the light within us, not just to live, but to renew, restore, and rejuvenate? As time goes on, we begin to show signs that things just aren't as they used to be. Energy fades, sleep declines, and healing takes longer. The reason? Our stem cells, the building blocks of renewal, become less effective over time. Since 2004, LifeWave has been delivering groundbreaking technology to help the body do what it was designed to do, only better. Introducing LifeWave X39, the first product in the world that activates stem cells using our body's own light. Backed by clinical research, multiple patents, and over 10 years of stem cell research, LifeWave's founder, David Schmidt, achieved something remarkable in the field of wellness and regenerative science. that others, despite years of research and billions in funding, could not. The result, a revolutionary wearable light technology that unlocks the power of activating our own stem cells with a single, safe, affordable, non-transdermal patch that puts you back in control of how you look, feel, and perform. Here's how it works. Unlike traditional light therapy, which requires external light sources, X39 uses the body's own infrared light. When an X39 patch is applied to any point on the body, our infrared light is reflected back into the tissue, sending a signal to the brain, activating a powerful peptide, GHK copper peptide, known to activate our stem cells. These younger, more effective stem cells then go to work, enhancing energy, relieving pain, improving sleep, accelerating recovery, and promoting healthier hair and skin. Unlike drugs or chemicals, X39 works naturally, awakening your body's ability to heal and thrive. Whether you want to boost energy for your busy life, recover faster, or simply feel your best, X39 supports your body's natural renewal process, helping you live long, live well, and live young. No matter your age or stage in life, your body is capable of more than you realize. It's time to unlock your full potential, restore your vitality, and embrace a healthier, more vibrant you. Be the light with LifeWave X39.
And I always get a big kick out of it when they're doing the count up with the age of the person. It ends at my age. So why the light? It says it's acupuncture meets quantum biology. And we wear these patches on specific acupuncture points. And so this isn't about a quick fix or masking symptoms. It's regenerating, it's activating the regenerative cells in our body. And before we go on, I want to make a comment and a little disclaimer. Dr. Lee talked about his experience. Our words tonight, his, mine, are not intended to be any kind of a recommendation for you to do anything similar or to be perceived as diagnosing, treating, or curing any kind of diseases. Anytime anyone goes on a new regimen or a protocol, you should contact your healthcare provider about that and discuss that with them. But ultimately, it is your choice. My results are maybe different from someone else's, as will yours, and they take different amounts of time with everybody. Having said that, get a patch on you. Lots of great things happen. Dr. Lee talked about GHK copper peptide. Let's learn a little bit more about that. Dr. Lauren Picard was the doctor who discovered it clear back in 1973. And you know what they did? They put old liver cells in a petri dish. That's where you do experiments on living things. And then put the GHK copper peptide in there. The old liver cells started acting like young liver cells. It reversed the age of the liver cells, and they started making proteins and enzymes like new liver cells do. David Schmidt says that he should have gotten the Nobel Prize for medicine. But then this is from the literature. There's the science has been, the experiments have been done, the research has been done since 1977. What it showed was that GHK caused adult stem cells to start producing again, and produces more stem cells and resets stem cells to a younger, healthier state. Skin and hair. Not going to read through all these. I encourage you to go to this website, Why the Light, and you'll see all of these benefits. But I want to say one thing about skin and hair. It not only shown in the literature that it causes the regrowth of follicles, hair follicles that were lost, but it induces them to be thicker. So the shafts are thicker. Not only do you get more follicles, but the shafts are thicker. That's shown in the literature. Not a claim made by LifeWave. Fast growing cells, use your imagination. We don't say that word on here. I can tell you the research shows that it helps reset the cellular death cycle of some of those fast growing cells. A friend of mine owns a regenerative cancer center, and he uses GHK copper peptide as part of his protocols to treat those people who have fast growing cells because of their action on that. Big lung protector, antioxidant, brain and nerves. This is why I use them in my clinic called Clear Mind Idaho. It has such a benefit on brains. There are so many benefits to brains. When I wrote that book, I had to break up the information into 3 chapters because there's so much benefit for the brain. Additional benefits, go to this website. You see increased myostatin. What does that do? Well, myostatin helps prevent cardiac failure, reduce and helps maintain fibrinogen levels. A high fibrinogen level is, if you have a high fibrinogen level, it's what makes your red blood cells sticky a little bit. You have to have some stickiness, or if you get a little cut, you'd bleed out. Well, it helps modulate the level of fibrinogen, keeps it in check so it doesn't get too high. Lots of other benefits. So let's go on in our little presentation. I mentioned I'm going to give you an update about Barbara. You're going to watch this short testimonial video, and I want to bring your attention to how this woman says the person's name who basically rescued her by reaching out, having the courage to reach out and tell her about the X39. I want you to notice the reverence with which she uses to speak Barbara's name.
I was saving for my 20th stem cell treatment, and Barbara showed up, and she put 2 patches on me, and by the time we finished talking, I was able to lift my legs much easier. It was amazing. And so I canceled my appointment, and I've been wearing the patches every day since.
And Barbara showed up. I love that. You know, after all is said and done in life, you don't get to take anything with you, but you leave things behind, and that's how you affected people and how you changed their lives and benefited their lives.
I have had migraines since I was 12. Within a month, I went from having like a dozen episodes a month to a couple. I'm like, let me cancel my subscription and see what's going to happen. And within a couple of weeks, my migraines were back. I'm like, just kidding. I have to say, my migraines are gone.
There we go.
Never expected to get this diagnosis, to be stage 4 at 37 years old, and then be able to have a clear scan. So, I'll forever be using these.
All right. There are lots of them here. Go here and read through or listen or watch some of those testimonials. Again, everyone's results are different. No promises or prescriptions or recommendations for treatment are made. This is how we wear it. We put it on specific spots on the skin. We wear it for 12 hours on, 12 hours off. People ask, why do you take it off after 12 hours? It's because your body gets used to it, and it's not doing you any more good by leaving it on. I had lasers in my clinics, and a protocol maybe 2 minutes, but I could leave it on for 20 and they wouldn't get any more benefits. Consider it like the bucket is full and you can't make it more full, and you use 1 patch each day. Now, the great thing is you can try the patch risk-free. There's a money-back guarantee. Go on this site and you can read about all of these benefits. I encourage you to go back and read them. There isn't time to read them all. I want you to hear a little bit from David Schmidt, the founder, because once you know David's heart and you combine that with the brilliance of David Schmidt, you'll understand when he says he wants to help the world, in all of these ways, you will believe him.
In the beginning, God created the heavens and the earth. There is more information there than most people would ever realize. I was 8 years old, and my parents wanted to take me to the workshop of Thomas Edison. On the drive back home, I said to my dad, I want to be an inventor. Light, as it turns out, is the primary control mechanism for everything else that happens in the body. What if we could have an external electromagnetic field that would essentially reset the stem cells that are already in our bodies and get them to function like younger, healthier cells? What if in the process we actually found out that in a book that was written thousands of years ago, that information already existed? God has left his fingerprint in natural design, and that blueprint shows up in nature. The mathematical codes are identical. The implications to this are absolutely extraordinary. What drives me is that there's this enormous sense of hope that we can create technology to generate clean energy, that we can have foods that aren't genetically modified, and we can meet all of the needs on the planet that we have to, and that we can heal people.
That is our founder, our scientist, our CEO, David Schmidt. Brilliant, brilliant man. So how do you get these? Well, funny you should ask. A person has several different options when looking at purchasing these products. So the first way is a one-time purchase of $149.95 for a 30-day supply of the X39. Now, when you embark on this journey, you must consider it like I'm remodeling my house. And first I have to tear things down, and you don't want to just stop right in the middle of the kitchen tear down. You want to consider using the patches at a minimum 1 month for every decade of your life. You have to give your stem cells a chance to do their job. You can't, you can't accelerate that process. So for those who want to be a customer, if you go get set up for a subscription, the company will give you wholesale, just like branding partners get. And I'll explain what that means. So for $99.95, you can become a customer and then receive another 30-day supply in 1 month and so on. Or for those of you who think there may be an opportunity here to not only help people, but also pay attention and help your wealth part of your life. That's part of life too. And so the company gives you less than wholesale cost in these packages. The first one, you get $300 worth of product for $295. The next one, you get $600 worth of product for $535, and even bigger discounts over here. The core would be enough for one person for about 2 months, depending on which patches you get. The advanced would be more for 2 people, maybe 3. If you have a family, you're going to want to get the advanced pack. The premium would be for those of you who own clinics and want to have some on hand, or for people really serious about the business and want to move fast so they can have some product on hand and give it to their people, give it to their customers and other branding partners. So that is how you can actually get some of those patches ordered. So I encourage you to get with the person who invited you here to this webinar. And also, I just want to have a brief conversation with the people who are here for the first time. Just you and me. Those people who came into your head, when you were thinking about the benefits and you thought of, something they have going on, those people need you. You may be the only person in their circle who hears about X39. It's not advertised. You might be their Barbara. I want to encourage everybody on this call, be somebody's Barbara for them. They need you, their health needs you, and it might be you are your own Barbara by getting some of these patches ordered. I want to welcome you to come and join us next week. We do these, I do this every Wednesday night, 6 o'clock my time, 5 o'clock Pacific. And I'll see you on the next Doctor and Athlete podcast. Hope to see you there. See ya.